A cruise ship quarantined off West Africa is now expected to go to Spain's Canary Islands after 2 people with the dangerous hantavirus are airlifted off the ship. 3 passengers have died. Health officials now say the illness may have spread between passengers. Tom Hanson has more from an American on board.
We're not just a story. We're not just headlines. We're people with families, with lives.
Jake Rossmarin is one of 150 passengers, including more than a dozen Americans stuck on board the MV Hondias cruise ship. This morning, the World Health Organization said the ship will continue to Spain's Canary Islands after 2 passengers with the dangerous hantavirus are medically evacuated. The cruise ship is currently off the coast of the West African nation of Cape Verde.
All we want right now is to feel safe, to have clarity, and to get home.
7 passengers are believed to have gotten hantavirus. 3 have died, and 1 person who is critically ill has already been hospitalized. The cruise set sail from Argentina more than 4 weeks ago on a journey to remote locations, including a visit to Antarctica. But the suspected hantavirus outbreak, which is typically spread through contact with rodents, has left them stranded.
They were doing, a lot of things with wildlife. So our assumption is they were infected off the boat and then joined the cruise.
For CBS Mornings, I'm Tom Hanson.
All right, so let's talk about this with medical correspondent Dr. Céline Gounder. She is also editor-at-large for public health at KFF Health News. Dr. Gounder, good morning. For those who may remember, the hantavirus was a contributing factor in the death of Gene Hackman's wife. So what is it, and how do you get infected?
So hantavirus is a family of viruses that infect rodents, so rats and mice. You get infected usually by breathing dust that has been contaminated by rodent droppings or urine. I think I need to emphasize this is exceedingly rare. There have been fewer than 900 cases over 30 years in the United States. Now, we know there have been at least 3 deaths related to this particular cluster. As we said, 2 people airlifted, at least 1 person in the ICU in South Africa. And there are additional people who are currently being tested.
So it spreads from person to person?
Well, rarely. So there's a particular form of hantavirus called Andes virus, which spreads in Argentina and Chile. And so this cruise ship took off from Argentina, which is why we're wondering, is it the usual kind, or is it a kind that can be transmitted person to person? Now, the biggest outbreak of that was in 2018 in Argentina, involving 34 cases. 11 people died, so it's quite a high case fatality rate. But I think it's important, again, to emphasize that this is a virus that requires prolonged close contact. This is not a pandemic kind of virus.
How can you protect yourself from it?
So cleaning. If you're going to be cleaning droppings, other kinds of things related to rodent contamination, you want to have a respirator, gloves. You don't want to be sweeping or vacuuming because that can kick up the dust. Use watered-down bleach to help it settle. They're also going to have to investigate the cruise ship. What's the source? Who, getting the testing done? How was it transmitted? And this is really the work of public health agencies like the CDC that's been gutted, and we've pulled out of WHO. So we're a little bit, caught flat-footed here.
Gotcha. Dr. Gounder, thank you.